What is acid reflux? Acid reflux is when the acid that is normally in your stomach backs up into the esophagus. The esophagus is the tube that carries food from your mouth to your stomach. When acid reflux causes bothersome symptoms or damage, doctors call it gastroesophageal reflux disease or GERD.
When you swallow food, it travels through a tube called the esophagus. The esophagus leads into the stomach through a hole in a sheet of muscle called the diaphragm. There's a round muscle at the bottom of the esophagus that works like a valve. The muscle relaxes when you swallow, allowing food to pass into the stomach. Certain cells in your stomach, called proton pumps, release acid to help digest the food. The lining of your stomach protects it from the acid. The esophagus has a different type of lining, which looks like it's made of smooth tiles. The valve is designed to close tightly after you swallow, so nothing comes back into the esophagus. Your diaphragm is also meant to pinch securely around the esophagus, closing off the opening to your stomach. It's normal for a small amount of acid to occasionally splash into the esophagus. This is called reflux. That word means flowing back. A small amount of reflux doesn't usually cause any harm. But if acid splashes up into the esophagus over and over again for years, the esophagus can be damaged. There are several reasons this might happen. It's not uncommon for the valve to become weaker, so it doesn't close tightly. That allows acid and partially digested food to come up into the esophagus. Sometimes the diaphragm weakens around the esophagus, allowing the hole to become larger. This hole is called the hiatus. When it becomes larger, part of the stomach may bulge through it. This is called a hiatal hernia. The hernia may cause the esophagus and the valve to move up. In that case, the diaphragm is no longer reinforcing the valve. That makes it more likely that acid will get into the esophagus. When acid and food splash up into the esophagus repeatedly, it's called gastroesophageal reflux disease, or GERD.
Conditions that can increase your risk of GERD include obesity, bulging of the top of the stomach up into the diaphragm, hiatal hernia, pregnancy, connective tissue disorders, such as scleroderma, delayed stomach emptying. Factors that can aggravate acid reflux include smoking, eating large meals or eating late at night, eating certain foods, triggers, such as fatty or fried foods, drinking certain beverages, such as alcohol or coffee, taking certain medications, such as aspirin. What are the complications of GERD? Over time, chronic inflammation in your esophagus can cause narrowing of the esophagus, esophageal stricture. Damage to the lower esophagus from stomach acid causes scar tissue to form. The scar tissue narrows the food pathway, leading to problems with swallowing. An open sore in the esophagus, esophageal ulcer. Stomach acid can wear away tissue in the esophagus, causing an open sore to form. An esophageal ulcer can bleed, cause pain and make swallowing difficult. Precancerous changes to the esophagus, Barrett's esophagus. Damage from acid can cause changes in the tissue lining the lower esophagus. These changes are associated with an increased risk of esophageal cancer. How is GERD diagnosed? Your doctor might be able to diagnose GERD based on a physical examination and history of your signs and symptoms. To confirm a diagnosis of GERD, or to check for complications, your doctor might recommend upper GI endoscopy. Your doctor inserts a thin, flexible tube equipped with a light and camera, endoscope, down your throat, to examine the inside of your esophagus and stomach. Test results can often be normal when reflux is present, but an endoscopy may detect inflammation of the esophagus, esophagitis, or other complications. An endoscopy can also be used to collect a sample of tissue, biopsy, to be tested for complications such as Barrett's esophagus. 24-hour ambulatory acid, pH, probe test. A monitor is placed in your esophagus to identify when, and for how long, stomach acid regurgitates there. The monitor connects to a small computer that you wear around your waist or with a strap over your shoulder. The monitor might be a thin, flexible tube, catheter, that's threaded through your nose into your esophagus, or a clip that's placed in your esophagus during an endoscopy and that gets passed into your stool after about 2 days. Esophageal manometry. This test measures the rhythmic muscle contractions in your esophagus when you swallow. Esophageal manometry also measures the coordination and force exerted by the muscles of your esophagus. Lifestyle and home remedies. Lifestyle changes may help reduce the frequency of acid reflux. Try to maintain a healthy weight. Excess pounds put pressure on your abdomen, pushing up your stomach and causing acid to reflux into your esophagus. Stop smoking. Smoking decreases the lower esophageal sphincter's ability to function properly. Elevate the head of your bed. If you regularly experience heartburn while trying to sleep, place wood or cement blocks under the feet of your bed so that the head end is raised by 6 to 9 inches. If you can't elevate your bed, you can insert a wedge between your mattress and box spring to elevate your body from the waist up. Raising your head with additional pillows isn't effective. Don't lie down after a meal. Wait at least 3 hours after eating before lying down or going to bed. Eat food slowly and chew thoroughly. Put down your fork after every bite and pick it up again once you have chewed and swallowed that bite. Avoid foods and drinks that trigger reflux. Common triggers include fatty or fried foods, tomato sauce, alcohol, chocolate, mint, garlic, onion, and caffeine. Avoid tight-fitting clothing. Clothes that fit tightly around your waist put pressure on your abdomen and the lower esophageal sphincter. Alternative medicine. No alternative medicine therapies have been proved to treat GERD or reverse damage to the esophagus. Some complementary and alternative therapies may provide some relief, when combined with your doctor's care. Talk to your doctor about what alternative GERD treatments may be safe for you. The options might include herbal remedies. Licorice and chamomile are sometimes used to ease GERD. Herbal remedies can have serious side effects and might interfere with medications. Ask your doctor about a safe dosage before beginning any herbal remedy. Relaxation therapies. Techniques to calm stress and anxiety may reduce signs and symptoms of GERD. Ask your doctor about relaxation techniques, such as progressive muscle relaxation or guided imagery. Foods to avoid. Certain foods and beverages can exacerbate GERD symptoms, including heartburn and a sour taste from regurgitation. Items that people with GERD are often advised to avoid include alcohol, caffeine, carbonated beverages, chocolate, citrus fruits and juices, tomatoes and tomato-based foods, garlic, mint, onions, spicy foods, fatty foods and fried foods.